Imagine suffering from a mental illness that causes you to believe your significant other is an imposter set on harming you, or which convinces you that books are for eating, or worse yet, that you have somehow become the walking dead. While only a small percentage of people are forced to live with these disorders, the fact remains that 450 million people worldwide suffer from mental illness. In the United States alone, 1 in 4 families is affected. While some mental disorders such as depression can occur naturally, others are the result of brain trauma or other injuries. Although it is fair to say that any mental illness can be scary for those suffering, there are a few rare disorders that are especially terrifying. Alice in Wonderland Syndrome. Alice in Wonderland may be pure fantasy, but one of Alice's more bizarre experiences shares its characteristics with a scary mental disorder, known as Todd Syndrome. Alice in Wonderland Syndrome causes one's surroundings to appear distorted. Those suffering from Alice in Wonderland Syndrome will hear sounds either quieter or louder than they actually are, see objects larger or smaller than reality, and even lose sense of accurate velocity or textures. People who experience AWS are more likely to experience migraines. Some researchers believe this disorder is actually an aura. This is an early sensory indication of a migraine. Others believe AWS may be a rare subtype of migraine. It's not clear what causes this disorder. Researchers believe unusual electrical activity in the brain causes abnormal blood flow to the parts of the brain that process their environment and experience visual perception. This unusual electrical activity may be the result of several causes. AWS primarily affects children and young adults. Most people grow out the disordered perceptions as they age, but it's still possible to experience this in adulthood. Apothemophilia, known also as body integrity disorder and amputee identity disorder. Apothemophilia is a neurological disorder characterized by the overwhelming desire to amputate or damage healthy parts of the body. Though not much is known about this strangely terrifying disorder, it is believed to be associated with damage to the right parietal lobe of the brain, as a small sample of people with body integrity dysphoria connected to their left leg have had MRI scans that showed less gray matter in the right side of their superior parietal lobule. The amount of gray matter missing was correlated to the strength of patients' desire to remove their leg. Because the vast majority of surgeons will not amputate healthy limbs upon request, some sufferers of apothemophilia feel forced to amputate on their own, a dangerous scenario. Of those who have had a limb removed by a doctor, most are reportedly happy with their decision even after the fact. Capgras delusion. Capgras syndrome is a psychological condition. It's also known as an imposter syndrome. People who experience this syndrome will have an irrational belief that someone they know or recognize has been replaced by an imposter. They may, for example, accuse a spouse of being an imposter of their actual spouse. This can be upsetting for both the person experiencing the delusion and the person who is accused of being an imposter. In some cases, the person experiencing the delusion may believe an animal, object, or even a home is an imposter. Capgras syndrome can affect anyone, but it's more common in women. In rare cases, it can also affect children. Capgras syndrome is most commonly associated with Alzheimer's disease or dementia. Both of these affect memories and can alter your sense of reality. In some cases, a brain injury that causes cerebral lesions can also cause Capgras syndrome. This is most common when the injury happens in the back of the right hemisphere, as that's where our brains process facial recognition. People with epilepsy may also experience Capgras syndrome in rare cases. Right now, there is no prescribed treatment plan for people with Capgras syndrome because more research needs to be done. The most effective treatment is to create a positive, welcoming environment where the person affected by the syndrome feels safe. Some care facilities will use validation therapy. In validation therapy, delusions are supported instead of rejected. This can reduce anxiety and panic in the person experiencing the delusion. Obsessive-Compulsive Disorder OCD manifests itself in a variety of ways, but is most often characterized by immense fear, anxiety, and recurring thoughts of worry. It's only through the repetition of tasks that sufferers of OCD are able to find relief from such overwhelming feelings. To make matters worse, those with OCD are often entirely aware that their fears are irrational, though that realization alone brings about a new cycle of anxiety. OCD comes in many forms, but most cases fall into at least one of four general categories. 1. Checking, such as locks, alarm systems, ovens, or light switches, or thinking you have a medical condition like pregnancy or schizophrenia. 2. Contamination, a fear of things that might be dirty or compulsion to clean. Mental contamination involves feeling like you have been treated like dirt. 3. Symmetry and ordering, the need to have things lined up in a certain way. 4. Ruminations and intrusive thoughts, an obsession with a line of thought. Some of these thoughts might be violent or disturbing. Doctors aren't sure why some people have OCD, but there are some risk factors that have been studied, and it include a parent, sibling, or child with OCD, physical differences in certain parts of your brain, depression, anxiety, or tics, experience with a trauma, a history of physical or sexual abuse as a child. A typical treatment plan for OCD will usually include both psychotherapy and medications. Combining both treatments is usually the most effective. A form of psychotherapy called cognitive behavioral therapy (CBT) and psychotropic medications are first-line treatments for OCD. The specific technique used in CBT is called exposure and response prevention, which involves teaching the person to deliberately come into contact with the situations that trigger the obsessive thoughts and fears without carrying out the usual compulsive acts associated with the obsession, thus gradually learning to tolerate the discomfort and anxiety associated with not performing the ritualistic behavior.
Thanks for watching. If you like this video, don't forget to hit the like button and share it with your family and friends. If you want to see more videos, don't forget to hit the subscribe button and ring the bell.